કેમ બંધ થઈ ગયું?
ના ના
યુટ્યુબમાં સેટિંગ કરે છે ને?
યા યુટ્યુબમાં કરે છે પછી વિલ સ્ટાર્ટ.
હા બરાબર. શું કેવું છે કહો?
બસ કઈ
કેલિફોર્નિયામાં
તમે આવો છો યુએસએ માં? હવે છેલ્લે ક્યારે આવે હતા?
નવરાત્રીમાં આવવું છે.
ઓહ
6-1 મહિના થઈ ગયા. નવરાત્રીમાં આવું છું. 10 તારીખ 10 સપ્ટેમ્બરે છે ટિકિટ.
ઓકે
10 સપ્ટેમ્બર.
He's asking to mute everybody.
હા હા તો બંધ આપણે બંધ
No,
કરી
no,
નાખીએ.
fine. It's fine. It's fine. So, good morning, friends. Welcome back to Saturday Club of Baroda morning meeting. And it's a very pleasant moment to have Dr. Manoj Shah with us. Not only present because he is an eminent gastroenterologist, pediatric gastroenterologist, but because he's an alum of Baroda Medical College, which always make us more nostalgic about our college days. So, welcome Dr. Manoj Bhai to Saturday Club of Baroda meeting. And today he is going to talk about leaky gut and intestinal permeability, what the fuss is about, its role in health and disease. And to formally introduce Dr. Manoj Shah, very briefly, because his CV is very long. To his credit, he has several positions, several awards, several publications also. Essentially, he did his MD Pediatric from Baroda Medical College way back in 81. And later on, he moved to USA where he got certified by American Board of Pediatrics, American Board of Gastro, and American Board of Nutrition. And he's a consultant gastroenterologist working in USA. And he has held several organizational and academic positions, and he has several publications and lectures to his credit. And he is an avid marathon runner also. So, welcome Manoj Bhai. And now, you have about 40-45 minutes to talk, and we'll keep some 10 minutes for interactive session. So, over to you, Manoj Bhai.
So thank you everybody. Can you see my screen?
Yes, yes.
Thank you for inviting me actually to talk here. I had talked to Baroda Medical Club in past, in 80s when I came back, and in 90s, but had not seen many of you for a while. So I'm going to talk about leaky gut. It's a new name, but it's a very old kind of topic that what is all first about the role of leaky gut in having us stay healthy or also get us into some kind of problem with any system, not just the GI tract. So first thing is we talk about the functions of gastrointestinal tract. So what are the functions of GI tract? And everybody starts with taking intake where oral cavity, we take the food in. The food is transported from esophagus into the stomach where there is some mechanical digestion by stomach, and then there is chemical digestion by enzymes and bile and pancreatic fluid. And after digestion, food is absorbed from intestine, and then whatever is not absorbed is excreted through large intestine and colon. So these we think are the functions of gastrointestinal tract. However, for me, the most important function that's not on this is intestinal function as a barrier. It is not just the intestine, throughout the intestinal tract, from oral cavity to the rectum, the most important function of gastrointestinal tract is to act as a barrier. The barrier is more like if you want to think about it, is like a fence between two countries, maybe between India and Bangladesh fence, which sometimes doesn't exist at all and sometimes very tight. But this intestinal barrier function is the most important function that we don't pay much attention to. So what is this intestinal barrier? Intestinal barrier is a functional entity separating the lumen of the gut from the host and consisting of chemical, biological, and mechanical or an immunological kind of barrier. If you look at more scientific way, we can say intestinal barrier is the main interface between the external environment and the host. And it maintains an equilibrated homeostasis by just allowing the passage of selective nutrients like amino acids, carbohydrates, electrolytes, lipids, water, while hindering the entrance of toxins and bacteria. So it has a selective barrier function. It allows certain things to go and doesn't allow many things to go. And if you go back 2,500 years ago, Hippocrates said that all disease begins in the gut. And that happens if intestinal barrier function doesn't work that well. So if we look intestinal kind of barrier function and what happens to whenever there is defect in it, there are many, many different ways people talk about it. But in the common kind of people, they call it leaky gut. I mean, if you look in journal articles, you will not see that, but you will see it in newspapers and other magazines mentioning leaky gut as a problem. Leaky gut is a proposed digestive condition where the intestinal lining allows bacteria and toxins to enter into the bloodstream. It is not a scientific term as such. More scientific term is intestinal permeability. And intestinal permeability is defined as a functional feature of the intestinal barrier, which can be measured by analyzing flux rate across the intestinal wall as a whole or across wall components of defined molecules that are largely inert during the process and that can be adequately measured in these settings. So intestinal permeability is kind of measured by using inert substances that cannot be altered. I want to just add one other thing in this, and that is protein losing enteropathy. It is a condition in which excess loss of the protein occurs through the gastrointestinal tract in the lumen due to the many different etiologies, inflammation, ulcers, lymphatic obstructions like that. So I want to emphasize the kind of difference between protein losing enteropathy and intestinal permeability problem where we call it leaky gut. So if you look, then in this picture, you can see the blue part here. This part is the lumen of the intestine, intestinal epithelium, intestinal wall, and submucosa and the wall of the intestine. So when the substances from the lumen of the intestine are not allowed to enter into the intestinal epithelium, but some of that are allowed, we call selective absorption. But when these molecules go between the two epithelial cells, past that blue thing, we call it leaky gut, that increase intestinal permeability. However, this is not a one-way street, it is two-way. Things from within the intestine can also go out into the lumen, which are not supposed to go, but still can go out. So these are the proteinaceous material that can go from intestinal submucosa or even the deeper layers and go out into the lumen. We call that protein losing enteropathy. So we are going to talk more about leaky gut, where things are allowed to enter into the intestine even though they are not supposed to go through. So there is some kind of a problem in this intestinal barrier function where it allows substances that are not supposed to enter still go through into the intestine. Now, how does this intestinal barrier function work? If we look at first, we look at anatomy of the intestine, and everybody knows intestine is a hollow tubular organ. It is not just like a pipe, straight pipe. The inside of the intestinal wall, you can see many folds on it. Even on these folds, there are many folds. And if you look each fold of this, there are many, many folds on this. This we call villi of the intestine. Now, these are meant to increase the surface area of the intestine. If we stretch the whole intestinal kind of mucosa, all the villi are flattened and make it straight, it will cover at least half the badminton court. So it makes 20 feet intestine into half a court of actually badminton. So that allows a lot of surface area for absorption. Now, when there is problem of allowing substances to go through the intestinal epithelium, we say there is selective actually passage of certain materials that are allowed to enter the intestinal epithelium. So if we look, this is the intestinal epithelial cell, and this is the second cell. There are two cells, and this is the lumen, this is the wall where the capillaries and actual blood. So there are many different ways we can allow the selective passage of nutrients or materials to go from the lumen into the intestinal epithelium. So if we look, the first mechanism is lipoidal fusion. It means that if a substance is soluble in the fat, it can be dissolved into the cellular wall of the epithelium and can be transported into the epithelial cell. The second way the substance can be transported from the lumen into the intestinal epithelium is if you have some kind of a receptor. And these are maybe there are many different type of receptors, each one separate for amino acids, electrolytes, glucose. Those substances, they can bind to this receptor and then transport it into the epithelium. Now, there are similarly receptors in the epithelium which will transport some of the material from intestinal epithelium into the lumen. And why I'm saying this is that these are an important material that may help in maintaining intestinal barrier function. These are many times some kind of immunologic kind of proteins. Most important is secretory IgA that is secreted from epithelium into the intestinal lumen, and that gets across through the receptor. The fourth mechanism by which any substance from the lumen can get into the epithelium is endocytosis. It means that material, it's a large molecule. There are no receptor for it, so it is like peptides or some bacteria or some that can be encircled by the cellular wall and then made into vesicle, and that then vesicle is engulfed into the epithelial cell. The one part that is very important that we are going to talk about is the paracellular pathway. Paracellular pathway is between the two epithelial cells. Normally, there should not be any space between the two, so there is nothing can go from intestinal lumen into the epithelium. Now, these two cells are joined by what we call tight junctions. So if you look at the intestinal epithelium, one epithelium, other epithelial cell, between the two, there are this kind of gap is closed by this junction. And this is made up of proteins. These are mainly two proteins, occludin and the chlorine, but they are kind of maintained in tight position by the zonulin. Zonulin is intracellular, and actin. You know all these actually different type of the proteins, but these are important to maintain this tight junction. Now, even when they are tight, the gap between the two intestinal epithelial cell remains less than 6 Armstrong unit wide. So it's a very narrow. So 1 Armstrong unit is 1/10 of an actually nanometer, or 10 to power minus 10. So it's a very small space, and that space is closed by this tight actually junction. So how can we measure this? How can we measure intestinal permeability? We say, okay, we are going to talk about intestinal permeability, but how can we say this? If you're going to talk about fever, we measure temperature. So is there any way we can measure intestinal permeability? So to measure it, we want to see anything that is going through this paracellular pathway. So for this, it has to be an inert substance. It means should not be taken up by any kind of receptor or anything. And it should be small enough that it will pass through this. And so there has to be around 6 Armstrong unit wide, those molecules. Anything larger than that, if that pass through this pathway, then we will say there is increased intestinal permeability, or there is leaky gut. It means that this space has widened and is allowing larger molecule to go through. So the one we know is the mannitol. You know the mannitol, everybody has heard about it. Mannitol is used in many medical conditions, but mainly for increased intracranial pressure. So mannitol is very small molecule. It's only around 6 Armstrong unit. So normally it will go through that paracellular pathway. So what you can do, you can give mannitol and measure it in the blood, but then it depends on gastric emptying time, how long it takes to go from stomach to the intestine, how fast intestine is moving. So it becomes a little hard to time it. And also you cannot continuously monitor kind of this mannitol in the blood. So we kind of measure mannitol in the urine, how much is excreted over a certain period of time. Now, if we use a larger, then normally mannitol should go from oral ingestion into the kind of urine. However, larger molecules should not go through larger than mannitol, and the larger than mannitol molecule is lactulose. it is about 9 Armstrong unit. So if it goes through, then we can say that intestine is more permeable. It is wider, that paracellular space, or the tight junctions are not as tight. The problem is because of decrease or variable change in gastric emptying, variable change in excretion of these substances in different people, we cannot measure only the lactulose excretion. So what we do is you measure the ratio of excretion of lactulose over mannitol and see how much of mannitol is excreted and how much of lactulose is excreted. And you can come up with the ratio that will tell is intestine more permeable or not. So if you look at normal values, now this is not done routinely, but it is available. You can do lactulose and mannitol analysis. No, it is not very hard, but it is not routinely done in any of the clinical labs. There are very few labs in the US that will do this. And you look at the percentage excretion of lactulose over mannitol, and that ratio, lactulose to mannitol ratio in healthy person is about 0.03. If it is more, then you can say that intestine is more permeable. So what is the importance of this test? Actually, it is not much helpful in the clinical setting, and nobody uses it in the clinical setting much. Mainly it is used for the research purposes, but it can be helpful in food allergies, celiac disease, inflammatory bowel disease like Crohn's disease. More important is type 1 diabetes, we think is secondary to increased intestinal permeability, being sensitized by some kind of antigen. And one interesting article a few years ago was screening of high-risk group, like family history of inflammatory bowel disease or celiac disease. You can screen those family members who have not developed the disease and see how is their intestinal permeability. And in some, increased intestinal permeability dates back up to 8 years before they develop the disease. So they may have primary problem of leaky gut or increased intestinal permeability causing that intestinal disease or autoimmune disease or diabetes or whatever. But this is not, this was only one study. This was not kind of proven in any other study. So what is this intestinal barrier function? Intestinal kind of barrier, as we talked about first, there are kind of mechanical barrier, chemical barrier, and biologic barrier. So first actually barrier is the layer where there are a lot of bacteria in the lumen, and they are in the mucus layer. So there is below the bacteria is the mucus, and mucus sits on the top of the intestinal epithelium. And in the epithelium, there are immunologic cells. So there are 4 different barriers which prevents any substance from the lumen to go into the epithelium. First one is bacteria may prevent it from going. Other is the mucus may prevent it from going. Third is the intestinal epithelium may prevent it from going. And if it does go, ultimately immunologic cells will take care of the substance that has gone in, which was not supposed to. We are not going to talk about immunologic part of this in this talk. We are going to talk about first 3 layers that are important in the intestinal barrier function. So if we see on the right, this is a normal healthy intestine with normal intestinal barrier function where there are bacteria, mucus layer, epithelial layer, and there are food particles, there are some bacteria, they are not allowed to go in. But if you have a leaky gut and there may be problem with the layer of the mucus or bacteria are different, intestinal epithelium is abnormal, there is wide space between the 2 cells that allow stuff to go. So we will talk about each one of these one by one. So if we look, what causes increased intestinal permeability is actually damage to one of these barriers. So first one is disruption of the microbial milieu, or the what we call microbiome of gastrointestinal tract. These bacteria, if they are affected in some way, that can cause intestinal barrier function to be abnormal. I'm not going to talk too much about bacteria, but we know there are 3 main things that gut actually microbiome is helpful. One thing is it is important for host defense against pathogenic bacteria and toxins in the intestinal lumen. Second is it is important for development and maintenance of intestinal immune system. This bacteria stimulates the intestinal immune system and makes it what we call trained about how to deal with intestinal luminal bacteria. So it is important for actual development of intestinal immune system. And third, it can support digestion by supply of enzymatic activity. Some of these microbiome may contain some enzymes that can help digest certain food that actually human cannot digest. Or if you have deficiency, one of the common one is sucrase deficiency. There is a yeast that contains sucrase enzyme, so that yeast can help you digest actually sucrose. Also, other thing is not just digestion, but some of the bacteria supply macro and micronutrients. So macronutrients, if you have to think about, is short chain fatty acids. The bacteria ferment many of these carbohydrates and turn it into short chain fatty acids, which are then absorbed through colonic epithelium and then provide the source for energy. Other is vitamin B12. The bacteria synthesize bacteria in the colon, synthesize B12. Now, most of the B12 get absorbed in the ileum. So many times we think about B12 being made by bacteria, but may not be absorbed as much because those bacteria are mainly in the colon and B12 doesn't get absorbed as much from the colon. And the third important is actually vitamin K, which can be absorbed in the lower intestinal tract. So some of these ways the bacteria are helpful to maintain the intestinal barrier function. Now, what can make these kind of intestinal bacteria kind of fascinating is that there are many different types. There are some good bacteria, there are some bad bacteria. So good bacteria, we call them normal bacteria, and there are many of them are, you are aware, lactobacillus, and then bifidobacterium. These are what we call helpful bacteria, beneficial bacteria. There are opportunistic bacteria. It means they are not helpful, but they can be harmful in certain conditions. They are waiting for opportunity to cause the problem. And those are most important you think about is the Clostridium actually difficile. And the third type of bacteria we have in the intestine are pathogenic bacteria, and Salmonella, Shigella, Yersinia, Campylobacter. Those are kind of actually pathologic bacteria. So those are the ones that can definitely cause the problem, irrespective of presence of presence of opportunistic or kind of other helpful bacteria. So when you have change in intestinal biome, we call it intestinal dysbiosis, then you will have problem with this bacteria not helping in intestinal barrier function. So first important part that causes intestinal dysbiosis is use of antibiotic. Other is lack of nutrition to this bacteria. We call them actually prebiotic. Excessive sugar, fat in the diet, intestinal infection, chemotherapy, radiation, frequent cleansing. Many times people take enemas, but many times they do whole GI tract cleansing by PEG kind of solutions or strong laxatives. They actually remove a lot of this bacteria. Stress, travel in different part of the world will have different kind of bacteria in their food or water source and will alter intestinal biome. Prenatal colonization is the issue, and that is if the baby is born by C-section versus vaginal delivery, they will have different intestinal biome. Another one is nicotine use and alcohol. They alter the bacteria in the intestinal tract. So those can cause the problem. The second part that causes the problem is decrease in the mucus layer. So if we look at the mucus layer, mucus is throughout the gastrointestinal tract from mouth to the rectum, but the amount and type of the mucus is different. Stomach has very thick layer of mucus. Intestine has very thin layer, very thin mucus and very small layer. And as we go lower down in the colon, they have thick layer and thin layer. And the actual mucus is secreted by the goblet cells that are in the intestinal epithelium. So mucus is mostly water, but important part is the protein called mucin, and there are many different types. In the intestine is mucin too. Then there is some lipids that act as a barrier actually for the other things to go through because they are not dissolved in the fat. The other is antimicrobial peptides. These are kind of the proteins that goblet cells make that fight off against the bacteria or the toxins. There are lysosomal enzymes in it and secretory IgA and some electrolytes. So what is the kind of importance of mucus is it is a physical barrier. It will trap the bacteria and toxin in the thick layer, not allow bacteria to go through. It also acts as a kind of lubricant and allows the actually kind of movement of intestinal substances easily. It has some antimicrobial actually property, and more important, it itself is a nutritional source for the bacteria. So good bacteria can thrive on this mucin. If there is any problem with this mucus layer, you will have increased intestinal permeability. So first thing that causes decreased mucus layer is loss of goblet cells. So it means the intestinal epithelium is affected. Most common are infections or ulcerative colitis, inflammatory bowel disease. Other is dysbiosis. As we said, the bacteria may be good or bad for the mucus. Some actually will penetrate through this mucus layer. Third thing is change in your diet. One is decreased water intake, will alter the viscosity of the mucus. Use of the actual processed food in the diet. Processed food contain emulsifiers. Emulsifiers are going to dissolve the mucus layer. So it is important to avoid this actual processed food. Pesticides, nanoparticles, they all affect the mucus layer. Again, the frequent cleansing will kind of remove the mucus layer. GI motility disorder, both constipation or diarrhea, will alter the depth of the mucus layer. Then there are some rare genetic disorder where you can have the glycosylation defect, where they cannot make the mucin, or the mucus can be very thick, like cystic fibrosis. Use of nicotine, not just smoking, but also chewing tobacco, it may increase or decrease the mucus depending on the site. And last is alcohol will also affect the depth of the mucus layer. And the last one we're going to talk about intestinal kind of barrier function is intestinal epithelium. And intestinal epithelium, important part is the tight junctions. So if these tight junctions are made loose, then the bacteria or toxins or other substances can go through. So if you look at these tight junctions, they are between all intestinal epithelial cells. If you look, these two epithelials, between them is this tight junction made up of tight junction proteins we talked about before. They're chlorin, occludin, actin, and zonulin. These tight junctions may be affected by many things in the intestinal epithelium itself, because this actually protein is held tight by zonulin and actin. So if there is any intestinal epithelial damage, then this tight junction will become loose. And so one is gastroenteritis. More important is post-infectious enteropathy. It means infection has been taken care of, but the intestinal damage left by intestinal infection has not healed. So we sometimes see villous atrophy, but those post-infectious enteropathy will have increased intestinal, increased intestinal tight junction gap problem. Inflammatory bowel disease, celiac disease, important malnutrition, especially protein malnutrition. Other is radiation, graft versus host disease, ischemia of the bowel. Diabetes mellitus type 1 is known to have been associated with increased intestinal permeability from tight junction defect. And there are some genetic defects in the synthesis of this tight junction protein. So what kind of things can happen if you have increased intestinal permeability or if you have a leaky gut? There are a host of diseases described or mentioned occurring secondary to leaky gut. So most important, people think about gastrointestinal disorders. So these are, one is inflammatory bowel disease. We think ulcerative colitis especially may be associated with leaky gut. Celiac disease, malnutrition, food allergy is thought to be kind of related to tight junction problem where certain food can enter and incite allergic reaction. Irritable bowel syndrome or small bowel bacterial overgrowth. Now, in the liver, leaky gut is associated with fatty liver and metabolic associated steatohepatitis, primary sclerosing cholangitis, recurrent pancreatitis, diabetes mellitus type 1. These are kind of described in association with leaky gut. Some of the neurologic disorders, especially autoimmune type disorders, multiple sclerosis, Alzheimer's disease, autism, and all these have been described in the studies. So because of lack of time, I'm not going to go into each of one showing in different studies, but has been shown to be associated with something related to leaky gut. Some psychiatric disorders, depression, schizophrenia, chronic kind of fatigue syndrome. So in autism, people have kind of described how the mechanism worked through the intestinal tract. I want to emphasize that these biome that we talked about are not just in the intestine, they are on the skin, in respiratory tract, and there may be problem throughout all these different barriers in the body. And so some of the disorder associated in other systems may be associated with leaky gut. In the skin, we see atopic dermatitis, or actually psoriasis, which is an autoimmune disorder. They may be associated with leaky gut where antigen or allergen goes through the kind of defective intestinal barrier. More important, especially in ICU setting, is sepsis or endotoxemia, secondary to ischemia or hypoperfusion, where you have an increased intestinal permeability and bacterial translocation, which will then lead to bacteremia and shock and sepsis. Diabetes, rheumatoid arthritis is also shown to be associated with increased intestinal permeability. The last one that has been described is COVID-associated intravascular thrombosis. Asthma, as we talked about, kind of respiratory tract issues. Atherosclerosis, associated heart disease, may be because of inflammation that is required for these plaques to cause problem. And any chronic inflammatory conditions may be associated with increased intestinal permeability. There are some genetic diseases associated with increased intestinal permeability, but not only on the GI tract, but they affect other areas of the body. The first is hypomagnesemia and nephrocalcinosis, where there is renal kind of tubular permeability problem. Deafness, neonatal sclerosing cholangitis associated with actually ichthyosis of skin, and cystic fibrosis, where there is increased intestinal permeability. Now, many times people say, how can the fatty liver associated with increased actually intestinal permeability? So first thing is there may be translocation of bacteria that goes into the portal vein. And because the portal vein drains through the liver first, there are endotoxins from this bacteria. They go into the portal vein, where liver and Kupffer cells in the liver take care of those. But it leads to low-grade, mild kind of liver inflammation that can then start or incite steatohepatitis. So increased intestinal permeability could be associated with other nutritional problem, but I don't want to go into detail of each one. But important one, there are some helpful amino acids, and they are arginine and the glutamine. And actually, glutamine increases the actually protein kind of synthesis of the tight junctions and makes intestine less permeable. So actually, glutamine is considered a very important amino acids required for normal intestinal epithelial health. So when to suspect leaky gut? So I mean, it is a very kind of broad thing. There may be many, many different diseases associated with it, and not all of them are proven or 100% sure to be causing any other disease. But if you have a GI symptoms that are actually persistent without any other cause that you can find, so change in bowel movements, especially diarrhea, abdominal pain, particularly with intake of certain or specific food item, persistent actually bloating or excessive gas, or unexplained weight loss that may be associated with leaky gut, that may be causing some other intestinal or systemic disease. Any autoimmune disorder may be associated with leaky gut. Chronic inflammation like inflammatory bowel disease. Arthralgia is an important symptom, especially in GI. We see with IBD patients many times that they have joint pains without any arthritis or any inflammation. And we think it is from some endotoxins generated by this bacteria that gets translocated, and that causes arthralgia. Some kind of neurologic symptoms that are not kind of typically kind of identified as one specific cause. And now people think mainly about brain fog, but many times it may be associated with D-lactic acidosis, which is actually D-lactic acid is formed by the bacteria during their metabolism, and humans cannot actually metabolize D-lactic acid, and then it causes D-lactic acidosis, which causes neurologic symptoms. Skin condition, eczematous dermatitis or food allergy. In ICU, the septic shock, enteric bacteremia caused by enteric actual pathogens, may be secondary to leaky gut, and chronic use of NSAIDs, acid reducers like PPIs, they are associated with increased incidence of kind of leaky gut, and they may act secondary to change in microbiome. So other than doing that intestinal actual permeability test, what else we can do to look for marker of is there a kind of leaky gut or not? So one is we can look for GI tract inflammation, and we check stool inflammation markers like checking the stool calprotectin or lactoferrin. These are associated with inflammatory bowel disease, allergic enteropathy. Enteric bacteria in blood culture may point to leaky gut. You can check actually lipopolysaccharide endotoxin in the blood, and that's from the enteric bacteria secondary to leaky gut. There is now test available for the zonulin antibodies, which you can check in the stool or serum. Zonulin actually excessive zonulin antibodies will affect the tight junctions. And you can directly look at mucus on like histologic staining for the mucus. You can see how much is the mucus depth or the thickness. You can even aspirate this layer of the kind of mucus and send it for chemical analysis. These are not easily available tests, so we don't normally do. So once we know patient has leaky gut, or we say that it may be a problem, what can we do to either prevent or treat it? So first thing is in the diet. You should avoid energy-rich foods. Excessive amount of sugar or fat will lead to increase or change in the gut microbiome, which are going to affect the intestinal barrier function. Other is avoid processed foods. As we said earlier, any emulsifier is going to alter bacteria as well as the mucus layer. High-fat foods will affect the bacterial kind of metabolism. All polyols, mainly alcohol, unabsorbable sugars like xylitol, sorbitol, which are like the sweeteners in candies and diet foods. FODMAP foods, those are actually oligo and actually monosaccharides, which can be easily fermented. That will cause the problem. Gluten and casein, avoid these two important proteins, especially during up to at least 3 weeks after any intestinal infection. Because when you have increased intestinal permeability, these two proteins are highly antigenic that will start or incite autoimmune issues. And last one is avoid nicotine. What should you increase in your diet? So one is prebiotic or fiber that will be more like a food for the bacteria. Other is the glutamine we talked about. They're good for intestinal epithelial health and growth. Vitamin A, vitamin D, and zinc. These are the three that are helpful in intestinal epithelial health. Other one is the curcumin, but in a small amount, not excessive amount. So we say it should be more in the diet and not as a supplement. And that is an important part, because there are some who just develop on the doses of this curcumin in the tablet form, and there are some reports of issues with curcumin. And we can talk about it later in Q&A if we want to know more about it. The other thing you can do is use actually probiotics. Probiotics containing lactobacillus, bifidobacterium, streptococcus, or Saccharomyces boulardii. There is a yeast called Baker's yeast. It is actually nutritional yeast, and it is not a probiotic. It is not live. Only FDA approved actually probiotic is VSN number 3, which we use in inflammatory bowel disease sometimes, and use the fermented products. Yogurt, buttermilk, Yakult, Activia yogurt, kombucha, ginger beer. I mean, these are the ones that are fermented that will help in improving the actual microbial health. And use plant pigments. They're in berries and dark chocolate or dark green leafy vegetables, eggplant, spinach. Use of antioxidants in polyphenols that are in vegetables, tea, dark chocolate. Use of short-chain fatty acids. We say that short-chain fatty acids are important for intestinal epithelial health. There are now short-chain fatty acids enemas available, where you can take it in an enema form. It has to be prepared by a kind of special pharmacy, and you can take it 10 ml twice a day for a month, and then once a day for 1 to 2 months. And the last one that has been recently shown to decrease intestinal permeability, it means help in a leaky gut, is the lubiprostone, which work on actually chloride channel, and it stimulates or acts like a chloride channel and helps in kind of making tight junctions more tight. So all this could be helpful in kind of improving your gut health. And most important is avoid stress, physical as well as mental or psychological. Physical stress in the form of a lot of kind of physical activity or physical exercise has been also shown to alter intestinal permeability and gut microbiome. So I'm going to actually stop at this point and see if anybody has any question. I thought that it might be a little too fast an overview of a wide topic.
Yeah, thank you, Dr. Manoj. Can you please stop the screen sharing so we can have discussion? Yes. So that was a very informative, and we could see a very exhaustive list of conditions where you should suspect leaky gut and take specific measures. So now the house is open for question answers. So, Dr. Manoj, in pediatrics, people often promote probiotics as a treatment for acute viral diarrhea, and there's a huge market of probiotics. Your comments on that?
So anytime there is intestinal infection, viral, bacterial, it will alter the gut microbiome. Now the thing is, does it help in taking care of the infection? Probably not. It is more important to kind of restore the gut microbiome after the infection is gone or after the infection is taken care of. So during the stage of active infection, I actually don't like giving them any probiotic, especially in infants, because you may be aware that in NICUs, neonatal intensive care unit patients, they have shown translocation of these probiotic bacteria, and even that can cause actual bacteremia and infection. So I will avoid during the active phase of infection, but right after. So usually we say, what is the right after? Right? So viral infection, that say actually rotavirus or the norovirus, usually 72 hours, but the intestinal epithelial damage may be there up to 1 to 3 weeks. So I avoid giving it during first 2 weeks of this infection stage, but
Okay.
definitely give it afterwards.
Okay, but that can be served also by some foods, as you mentioned, no, fermented, like say yogurt, etc. Also,
Right, right. So
is it
if you
necessary
have
to give to each and every child?
right. So if you use fermented product with live bacteria, there are kind of lactobacillus, acidophilus, and those are in this fermented product. Uh, as long as they are not in excessive amount, I mean, there is still a live bacteria. The problem is prebiotic. You mentioned prebiotics are food for this bacteria. They are like actually fiber,
Fiber.
because they will then kind of ferment the fiber. So instead of giving them fiber, sometimes people give them this actually fermented type of product and thought to not have excessive amounts of this bacteria. When you use probiotic in a capsule form, if you see, there will be 10 to power 9 bacteria, I mean, actual colonies, or at least a billion cells per capsule you need to be effective. Now, we sometimes go back and see what our grandparents did, They will say, do not take milk, but you can have yogurt and chas.
Right.
And as I mentioned, that avoid casein during this phase, because casein can induce or start some type of autoimmune disorder. Casein and gluten are known to pass through this paracellular pathway quickly and start the problem. So it is good to avoid milk or casein, but not kind of fermented milk like yogurt or chas or kombucha, or those are okay.
Right.
It's still less than 4 months of age. I will not give any probiotic during active infection,
Okay.
including yogurt or anything like that, because there are some reports of bacteremia from there.
Any other questions from
Yeah,
the
I'm Dr. Manoj Yadav. Good morning, sir.
Yes.
I had read an article on leaky gut syndrome long back, and I had been interested in that. And I should
Yes.
say I'm happy to hear your talk. Sharing my experience in asthma patients, asking them to stop all food and have only soups and salads for a few days has actually helped my patients get very good results. And apart from that, kombucha you mentioned. So any specific like dose or anything in kombucha?
No, see, again, these are not, kombucha depends on how, say, it is made and kind of prepared. So you cannot actually quantify the kind of number of kind of bacteria. But we say that if you want the dose, it is 1 to 10 billion bacteria per dose.
Okay,
So
because kombucha has been in the limelight since a few years, like
yeah.
world over. Like even in Baroda,
Right.
only very few places we get kombucha. And I've tried on myself. I've got very good results for upset stomach,
Yeah.
upset gut.
Yeah, I mean, it helps re-establishing gut microbiome. So it is helpful. But again, we can use yogurt, or you can use, actually buttermilk, and then that will be fine too. But
Thank you, sir.
kombucha may have larger amount of bacteria, but in small volume. That's the issue. And
Dr. Sam has to ask.
another thing is the pH. The pH of kombucha is a little lower than yogurt or actually buttermilk. And there are some reports that when you have higher pH, you have increased kind of intestinal permeability or leaky gut. So sometimes when people in past used to just drink small amount of actually vinegar in the morning on an empty stomach to get more acid in their system. So kombucha may have that effect also.
Yeah, thank you, sir.
Okay.
Thank you, Dr. Shah, for excellent presentation and telling us the biology and the molecular pathways of gut. As a GI person for this thing, my observations are, I think milk, yogurt, and all the milk products are not healthy for any gut disease. They are same. Another question is that when you are giving probiotic, then why not add capsules of short chain fatty acids, which are the food, and both can be combined and they can restore the gut, because enema in the rectum cannot reach colon, sir.
Yeah, so, I mean, really good point, because short chain fatty acids will not reach lower down in the intestine. It will be digested and absorbed. So you cannot, especially short chain fatty acids are very, very easily absorbed. So it will not be kind of reaching where we want it to go. And
Yes,
other is,
especially in leaky gut. It can
Yeah.
cross blood-brain barrier also.
yeah, it can. Once it goes through the intestinal epithelium, it can. The thing is, it has been shown more for colonic epithelium and not for intestinal epithelium. So that's the second point. The first is digestion and absorption. Second is, it is all the studies that have shown its effectiveness is in colonic epithelium. So therefore people give it as short chain fatty acid enemas, because it will then work in the colon cells, colon epithelium only. It is not supposed to go into systemic circulation. It is just supposed to work only in the epithelium.
No,
And
GI,
Go ahead.
sorry. GI journals are full of healthy fecal transplantation now in adult
Yes.
gastrointestinal diseases also.
Yes,
So your
yes.
point is well taken, sir. But
Yeah,
we need
yeah.
some material which can transport the oral form of small chain fatty acids to the colon and release
Right,
it there.
Right. I mean, we don't have anywhere that will reach high up in the colon. It will be only reach about at the most about 12 to 24 inches. So we have sometimes used it in very, very refractory severe actually proctocolitis. Ulcerative colitis patients, especially if rectum is very severely involved, then it may help. But it requires a special kind of pharmacy to prepare it. So that has gone out of the favor. When I was a fellow about 40 years ago, that time we had used short chain fatty acid enemas, because that time there were no other medications available other than sulfasalazine and steroids for colitis.
Dr. Pradeep, please ask your
Yeah,
question.
good morning, everybody. This is a very interesting talk. Sir, is there any kind of a set of pearls for the gut health in general, in terms of diet, in terms of fasting, in terms of fluid intake, in terms of supplements, what to take, what not to take, what to avoid, how much, when, etc. So, if you have some small summary of that kind.
Oh my God, that's a little vast topic. You cannot just put it into.
I understand that. So
Yeah,
that's where I said
yeah,
a summary.
right. Actually, important thing is to avoid highly what we call
Processed.
highly kind of antigenic kind of proteins. That's one thing in the diet. If you can avoid those, so highly antigenic proteins, some are in grains like actually gluten. Other is milk, that is casein. Third is shrimp and egg. I mean, egg has, so especially whenever there is a leaky gut-like problem where you think you might have this infection or anything else, then or change in diet or something, microbiome change, avoid those things at least kind of during those times. The second thing is avoid the processed foods. Processed foods with high sugars, especially mono or disaccharides. So anything that is high sucrose, high glucose, high fructose corn syrup, sorbitol, xylitol, all those are not good for gut health. The third thing is energy-rich foods. Energy-rich foods are the foods that in small amount gives you a lot of energy or kind of lot of calories. So those are high carbohydrate, high fat kind of combination foods. And here we call it donuts and pizza and things like
Yeah.
that, you know. And those will kind of alter the bacteria. And then use the probiotics or any fermented food in your diet every day. You know, some, something from yogurt, or drink some kombucha, or I mean something like that. That will be helpful. Avoid NSAIDs as much as possible for gut health. That is one of the important things that you want to kind of remember, is to avoid those. And anytime you have to use any antimicrobial, be very judicious about its use, because it is going to be affecting not just that particular host, but many different down the road too in the bacteria kind of composition. So I mean, these are the few things that come to the top of my head, but
Yeah.
it's a kind of a big long thing to do.
Sure.
Most
Sure.
important part is to avoid all this problem when you have an increased risk of kind of leaky gut, which is, I think, is an intestinal infections. That's number one thing. And use of antibiotics or NSAIDs. Those times there is increased risk of kind of leaky gut. So avoid these things that we talked about during those times.
Very well. Thank you. If you have a tips around fasting, I mean, does it really have a beneficial effect on the gut?
So fasting is two-way. One thing is continuous fasting, where you fast for either a day or a few days at a time or something. And there are some studies done on Jain where initial it has shown to be kind of improving gut health, but down the road showing villous atrophy in those people. So and that goes from 1 week onwards. So that's an issue. That's kind of a problem with that type of fasting. Second thing now is intermittent fasting, where people say you eat only during certain time of the day and not eat for anywhere between 16 hours to maybe say 12 hours, 16 hours, 14 hours. Do not eat during those times. Again, there were initially some good report, but now again there are something that says it is not as good. So I think it is the amount that you eat throughout the day that is more important rather than how much you eat at one time. Because
At one
I've
time.
seen actually people who are on intermittent fasting may be eating more calories overall than those who don't just follow intermittent fasting, because they eat only for 8 hours. They have 2 or 3 big meals during that time.
True. Yes. All together. Yes.
Yes.
Thank
So,
you very much.
Fasting
Thank you.
seems to, at least intermittent fasting, initial report had shown it helps in insulin resistance, decreases insulin resistance, makes your insulin work better. So that way it may be helpful.
Okay.
Dr. Manoj, talking about use of probiotics along with antimicrobials is a very, I mean, pharma industry promotes it very heavily, and people do end up using probiotics every time an antibiotic is prescribed. I mean, how far rational is it?
To me, it is not rational to use probiotic with antibiotic. There are two problems with it. One thing is that antibiotic itself will make these actually bacteria not usable.
Resistant.
Because it's an antibiotic. It is kind of against that bacteria. And the second thing, however, is making some of these bacteria resistant. And this resistance can be passed on from one bacterial strain to other bacterial strain in the gut. That's the problem. That there are now, people have done genome studies on this microbiome and showing that resistant part from one bacteria that is run through kind of DNA changes is transmitted to entirely different strain of bacteria that is in the gut. So I think that it's better we should avoid during that time. But as soon as antibiotic is stopped, you should use some probiotic for at least 3 to 4 weeks.
Okay, good. And the role of probiotic in infantile colic.
Yeah, that's there is no kind of proven thing that it helps in the, because see, colic is very, very wide, again, kind of multifactorial problem. We don't know. Colic, you mean crying baby, right?
Right.
Right. So, I mean, we don't know, is this crying from what, intestinal problem or something else? And even in intestinal problem, is it from intolerance to, say, actually protein, or making excessive gas, or what, all those different things. So probiotic, as far as I am concerned, does not go to the root cause of the colic unless it is caused by excessive gas.
Right.
If it is an excessive gas problem, then yes, it may help.
Colic itself is a misnomer because the pain is because of the gastric motility
We don't know.
disorder.
Yeah, I mean, we don't know what we're talking about is a colic, Yes, that's the problem.
That's
Yes,
why
one
we call
word.
it infantile colic, because there is no known etiology for that. So, but it's a routinely used term, infantile
Yes.
colic, when the child has unexplained excessive crying, and because we do not know why the child is crying, there are multiple approaches that people adopt, and
So-
one of them is what is
Dr.
very
Shah, one point regarding bacteria. We are
Yeah.
10 raised to 13 cells, human body, and we have
Yeah.
10 raised to 15 bacteria over us.
Yeah,
And as a person who has made ginger beer, kombucha from the
Yeah.
remains of the mirchi, bacteria
Yeah.
are everywhere. So my recommendation since 40 years was that this arginine and glutamine are the food
Yeah.
for the intestinal cells. So the
Yeah, yeah.
legumes, sprouted legumes and
Yeah.
nuts which suit you, and dry
Yeah.
fruits,
Yeah.
the skin and the fruits with skin are the best probiotics nature has given us.
Yeah, we call them actually prebiotics, because they are the food for the bacteria. So they are not bacteria itself. So yes, this bacteria can use this, but arginine and the glutamine we talked about a little bit. I went very fast on it, but those are important amino acids for intestinal epithelial health. I mean, and it's big in surgery. I don't, maybe there are surgeons I had seen actually Jagdish Bhai earlier in here, but we know that surgeons are big, even in US, surgeons are big on glutamine to give after the surgery. Any intestinal
No, sir.
resection, they
Sir,
will like to.
our GI tract, we have stopped glutamine in India because legumes and dal bhat has 100 million times more glutamine than this thing. This is for meat eaters.
Right. So I'm just talking about here in US,
The
they have been,
glutamine powder has gone out of market in India.
yeah. That's good to know, But
So-
here everybody wants that special thing made just for that. So just the glutamine, just arginine, just the creatine, just the curcumin, not the whole thing. So, and those are a little bit problem,
Okay.
Okay, so thank you, Manoj Bhai. It was an excellent, informative talk, and the interactions were also very useful. So thank you all for participating actively. So we end the session here, and coming 2 Saturdays we are not having the meeting because of the festivals. So the next upcoming meeting will be on 23rd of this month. So till then, goodbye. Thank you all. Thank you.
All
Okay.
right.
Thank you.